All right, Dr. David Buck, thank you for joining me. And I want to dive into dental appliances because before we hit record, I was talking about a local dentist here who's selling me on this very expensive, long, tedious process, 2, maybe 3-year process of trying to expand my palate, open up my airways, supposedly improve my sleep quality, my breathing, my energy, and all of that. And so I tried the appliance and I got a headache. And I didn't like the feeling of it. And I've seen that many people, they have issues with the, uh, I guess, the side effects of these appliances. And you and I kind of talk through it, and it doesn't sound like there's a long-term goal for me. It's like I'm into the appliance, and then what? So I want you to just kind of riff on that for us. Tell us, what is the goal of these appliances for people for sleep apnea and for like breathing, airway issues? And then what makes more sense than what I'm being sold on?
Well, there are a variety of appliances that have been used for many, many years to try to expand the palate, there's good evidence. It's not very robust, but there's evidence that when you do expand the palate, you provide more intraoral volume for the tongue, and the tongue can come forward into the mouth, the oral cavity. And of course, the lower jaw coming forward is going to change the hyoid position, the hyoid bone, and also change the airway structurally. So the idea being that if you can do that in an adult, you can get some changes to the airway and probably sleep breathing. But there are fixed appliances, there are removable appliances, and there are surgical approaches. Now, we know that the adult patient isn't growing. However, bone remodels quite nicely throughout life, and you can induce bone to remodel, which means basically forming new bone. It's not technically growth, but remodeling is quite effective and can be utilized. And if you want to boil it down to the basic, the nasomaxillary complex, the upper jaw, it's one bone, the bone around the teeth, the sinus cavity, floor of the orbit, and part of the cheekbones, all one bone. And if you stimulate it with an appliance intraorally, everything responds in a remodeling sense. And the lower jaw is always kind of a victim of the upper jaw. The lower jaw has to functionally fit into or telescope inside the upper jaw. So it's going to distort its position and its shape and size in an attempt to fit into its, we'll say, underdeveloped or deficient counterpart. And that sets up a whole lot of problems with joints, muscles, airway, posture, everything. So the simplest explanation of airway dysfunction is an inadequate, poorly developed nasomaxillary complex. But the debate rages on. Can you do that with an adult non-surgically? The answer is yes. But the debate is, can you do it will it be stable? Will it be safe and long-term effective? That debate continues to rage on. The primary treatment methodologies have been established around separation of the midline palatal suture, which is very plastic, very remoldable in anywhere from a child between the ages of 4 or 5 all the way up through early puberty. Now, the evidence is that after puberty, the suture fuses and you can't really separate it, which is the traditional skeletal expansion at that level. So now they'll have a whole bunch of ways to do it with appliances that can separate the suture in adults, kind of a minor surgical procedure, and placing pins that are anchors in bone that can be used to put enough force on the bone to separate the palatal suture. Well, that's one aspect of just getting transverse or widening of the palate. The other appliances like the DNA and RNA attempt to slowly cause a bone response over a long period of time. And the research has shown you do get some changes that are positive, but you also get negative changes where the teeth begin to tip. So if you push on teeth will move and bone will follow it. But the teeth are, if you can push on bone and not teeth, you get a better response in my experience. So you have to be careful when you attach to teeth and you push on teeth because you're going to have some unwanted perhaps movement or flaring or tipping of teeth that may compromise their housing, their bony housing.
No, that's well said, and I feel that too, man. That way that DNA snaps in there, you've got those little metal prongs on the side, it kind of grabs onto them. Just intuitively, I'm like, man, this is not right. I feel like I've got suckered into it. I don't really enjoy the experience so far, but also my sleep quality is not that bad. I think that I hate to say this, but I'm just going to call it the way I see it, and you tell me if you see differently. But I feel like a lot of dentists now are going into this sleep medicine thing because it seems way more profitable than just regular dentistry. And you'll end up 5, 10, 20 grand into these appliances easily. And I'm like, where's the case studies? Where's the before and after? Now, you've actually got some good before and after photos I've seen. So what are you doing differently? And then tell me what you're seeing in the industry. And I'm not against making profit, but I'm just seeing that it's almost like it was a 5-minute appointment and then boom, here you go, you need it. It's like, really? Do I need it that quick?
Yeah. That there is some evidence. It's limited that when you expand the palate, adults and children, or you change the shape of the palate, which is generally considered the term is expansion, but there's a different way to look at that. You can improve the airway. We don't have a huge, robust history of those studies, but there are enough studies to show you can improve the airway and sleep. Now you get into another situation where practitioners, orthodontists, have decided that they look at the literature and say that sleep disease or sleep breathing disorders are a multifactorial issue, not just anatomy, craniofacial anatomy. And so they've ignored the idea that there's a direct link. But others have shown that in all forms, all phenotypes of sleep breathing disorders, craniofacial anatomy actually plays a role. So it's consistent in everything. So I'm of the opinion that craniofacial anatomy is really the source of sleep disordered breathing, and that you can effectively change that by changing the structure, shape, position of the jaws. And there's evidence from the DNA appliance that it works. There's evidence in reports, and limited number of patient studies they've shown improvements in the metrics from sleep studies. So there is evidence that you can do that, but there's also strong evidence, by the way, surgically. They've done what's called MMA, double jaw surgery for severe sleep apnea, when, let's say, the patient can't tolerate CPAP and they have no other option. And so if they do surgical advancement of the jaws, can be both widening but mostly forward, and then they follow up and do sleep studies, very good results over a fairly long period of time. It resolves the sleep apnea. That even gives more evidence to the craniofacial anatomy being the primary culprit for sleep disordered breathing.
Yeah, because if you ask some like conventional medical doctors that are actually doing like integrative medicine, they're going to blame it all on insulin resistance, obesity, things like that. They're just going to come in from the metabolic side of sleep apnea. So it sounds like you almost have to address it all then. And you're saying that these issues appear to be on the rise in children as well. Do you think that's just because we're now, what are we, five decades into processed food, and with the work of Weston A. Price and all the work he did on the ancestral diet versus processed diet? I mean, do you think that's why kids are just a mess? I mean, my kids, though, they eat amazing, but even my daughter, she still has crowding in her bottom teeth. She's 8, but in her permanent bottom teeth, she's already got crowding. I'm like, man, did we not breed out my parents feeding me processed food? Like, is that the issue?
Yeah, well, there's been a lot of discussion about that. There's very strong, evidence that our chewing patterns with processed foods are not sufficiently hard enough. We don't have the texture of the diet that pre-industrial and remote, non-Western civilization or tribal populations. And so the chewing is one of the primary stimuluses for the jaw to grow. And our diets, cooked foods, are such that we're never going to return to the textures of foods that could, unless you have augmented ancillary, chewing on top of it, but the diets are just not going to go back to what they once were. But the other two stimuluses for jaw growth are nasal breathing and tongue fully to palate. Now, the problem is our modern society is so full of chemicals, toxins, airborne allergens, mold, all the chemicals we're exposed to. It's a milieu, a soup of chemicals,
Yeah.
and the dietary inflammatory influence all lead to an inflammatory response, and the nasal tissues are very reactive, and then they congest. And so limited nasal breathing early in life is so common. There's only been 5 good studies that I know of, but they all show a very high percentage of children mouth breathe during sleep, maybe as 50 to 60%. So that's because of initially inadequate nasal freedom of breathing. And so mouth breathing, my contention is even an hour out of a 10-hour sleep cycle of incidental mouth breathing will alter the growth of the jaws.
Oh my gosh,
And
that's
you
huge.
can imagine if you have the tongue fully placed to the palate, you cannot mouth breathe. That's a physical impossibility. So the other very interesting correlation is that the vast majority of my patients I've seen over decades have a low tongue posture. Their tongue is not adapted to the palate, which just means they're missing that stimulus for mid-facial growth, number one. And number two, it means that they're very high risk of their mouth falling open during sleep, even incidentally, which breaks down the entire nasal breathing, system. You've got to have that tongue up in the palate to maintain better, more complete nasal breathing. So it's really interesting. The tongue's low in the mouth. The palate doesn't form correctly. The nasal cavity doesn't enlarge correctly. Then you get into a mixture of mouth breathing and nasal breathing, which throws off the growth of the jaws. Now the upper palate doesn't fully fit to the tongue, or the tongue doesn't fit to the palate as well as it could. And the cycle perpetuates. You have underdeveloping mid-facial structures, low tongue posture, and habitual mouth breathing, not necessarily obligatory, because the nasal cavity will congest if you mouth breathe. It's really interesting. If you reestablish nasal breathing with augmenting aids, let's say lip taping is one of the things that we use very commonly for our patients. And if you reestablish nasal breathing, it'll get better on its own. So it may not be inflammatory congestive issues from diet or from airborne allergens or toxins. It may be the cycle of habitual mouth breathing due to low tongue posture.
That's incredible. I've actually been doing mouth taping, and I want to talk to you about that. But I noticed that my brain is way more clear-headed if I tape my mouth. And if I'll do a nose strip, try to open the nose up, I'll wake up and I'm
Yes.
clear-headed. And now that you say it, I do feel like I've almost had a positive snowball effect in a way by continuous taping, to where my nose actually does feel, even though I have a deviated
Yes.
septum, I do feel that it is more clear. And I don't eat gluten, I don't do dairy, I don't do what I would think are the typical inflammatory sinus foods, but yet my sinuses still feel more open just by taping my mouth. So that is a real thing.
Yes, and whenever you mouth breathe, you lose, for one thing, the dynamics. You can experiment yourself. If the tongue is fully up in the palate and you breathe nasally, you'll open the lower lobes of the lung and you'll activate the diaphragm. Whereas if you just breathe nasally but the tongue is low in the mouth, you won't activate that or inflate that lower lobe of the lung, and you'll tend to begin to have shallower breathing. And the minute you have upper chest intercostal breathing, you activate the sympathetic nervous system. So mouth breathing activates the sympathetic nervous system and messes up metabolism and a whole bunch of downstream negative effects that go on. So it's like breathing is so important. Just breathing nasally itself is a parasympathetic stimulation. I mean, most of the practices of meditation and prayer revolve around nasal breathing. And in fact, yogis have talked about left side, right side differences in parasympathetic versus sympathetic. So nasal breathing is going to be a parasympathetic activator. Diaphragmatic breathing is a parasympathetic activator, and you get a better oxygenation of tissues from nasal breathing because of the ability to have a higher level of CO2 in the blood. The minute you mouth breathe, you blow off CO2 out of the lungs, you destabilize the gas balance in the alveoli, and so CO2 has to come out of the blood into the lungs to rebalance the gas balance in the alveoli. And so you end up becoming overly sensitive to CO2 changes. You breathe faster and shallower, and you get into sympathetic tone. So when you breathe nasally, you end up having because the higher the CO2 in the blood, the better the oxygen delivery to tissues.
Well, and then you end up with an anxiety diagnosis. You go to your psychiatrist. You get put on Xanax or benzodiazepine, lorazepam. You get stuck on anti-anxiety medication when it's your friggin' tongue that's causing your anxiety. You don't need a pharmaceutical anxiety medication. You need to shut your damn mouth and breathe out of your nose.
That's right. There's a whole science called buteyko breathing that revolves around recovery of CO2 tolerance in the blood and nasal breathing and breathing in a slower, lighter, deeper rate. Patrick McEwen's famous for this, and I've been through his courses, and so that's a very important consideration. It's so basic yet so much overlooked.
Yeah. When I'm sitting here,
dysfunctionality.
yeah, I know Dr. Mercola, he talked about that years ago, and I don't know if he ended up changing his mind or if he still promotes it, but I did mess around with it, and it did seem helpful. And even just while you're sitting here talking to me, I'm trying to be very cognizant and aware about putting my tongue up there fully. And I do feel that it does almost instantly open up the sinuses, and you do feel calmer that way. You do feel way
Yes.
calmer just to sit there like that. Now, the only thing I'm trying to figure out with the tape, now this is just kind of a microscopic question, but it could be a bigger one, is I'm trying to find like a safe tape because, 3M, they make a lot of those tapes and they all have those like forever chemicals, those PFAS chemicals in them. So I've used like the 3M micro pore tape. They call it a medical tape. They call it hypoallergenic, but I don't know. Have you looked into this at all? Any of these like forever chemicals in there?
Yeah, I haven't really looked into it, but that's a very good point. When we use the micropore 3M tape, the medical tape, there are many other tapes. You can look online, you'll see 20 or 30 different styles now of lip tape. Some that go outside the mouth and attach to the lower chin area, all kinds of different strategies for this.
So you would say for kids,
right.
So it looks like 3M makes one that they call a silicone adhesive, because that's what I wonder too. I mean, maybe it's a non-issue, but I just wonder long term if I'm putting mouth, and it says water resistant. So to me, that sounds like forever chemicals that have that, hydrophilic properties to it, like Rain-X or something you put on your windshield in your car.
Yes, PTFE.
But for a kid, I mean, so I've got 3 kids, 8, 5, and 2. I think my 5-year-old, I think she's a mouth breather. I really do. I can almost tell by the facial structure. So you would say even at 5, if I could just strip across the lips or even vertically across the lips, I should go ahead and do that, it sounds like.
I think so. I think the benefits way outweigh the risks, and you can assess, because we use that for a trial to see if the child can breathe nasally. By lip taping, we determine, let's say, if the tonsils and adenoids may need to be surgically removed. Well, one of the criteria in my practice, if the patient can lip tape successfully and breathe nasally at night, the natural release of nitric oxide through the paranasal sinuses will normally cause involution of the lymphoid tissue, the adenoid, and I've had cases that were slated for surgery, and several months after lip taping and myofunctional coaching, they didn't need surgery. So and it's also important to know if a child can lip tape successfully, then we know they have nasal patency. And if they can't, well, then we may refer to an ENT for some other issues or a naturopath related to nasal congestive issues that are persistent because of either diet, environment, or some other structural problem.
Okay, so you would say that the trial is what? Just if they feel like if they start to panic, like, hey, they think they're not getting enough air through their nose, or how do you fail them for that test, that lip taping test?
Well, we start with it. We ask the parents to use lip tape, let's say for 15 minutes when the child's either on screen time or TV, just to see how they do. They can introduce it slowly. The goal would be to have them wear the lip tape all night to see if that can work. And if it does, if they can keep it on all night, we know they can nasally breathe, and they'll probably feel better from having nasally breathe during sleep. And if not, we will work on nasal clearing strategies, very simple non-drug type clearing strategies. And we will do CT imaging. If we see physical obstructions, we'll refer on to the ENT.
Okay.
So it's basically determining whether or not that child can nasally breathe. There are myofunctional appliances that can be worn, like MyoBrace, that also will prevent mouth breathing. So lip taping is the easiest, lowest cost, way to do something. I have parents also go online and purchase Mile Munchie themselves.
Yeah.
It's appliance that you can buy, and you can use it to test if that child's going to be comfortable and acclimate to breathing nasally during the daytime, and then they can do it overnight as well.
That's cool. Yeah, we got the mild munchies for our kids, and they had this weird chemical taste and smell to them. I don't know what was that. It's supposed to be just medical grade silicone, but for some reason it smelled like,
Yes.
I don't know, laundry detergent or something. We reached out to the
Oh,
manufacturer. So anyway, we have a new one now. I don't remember the name of it. So it was an alternative to the mild munchie. My kids just they're so resistant to use it though. We tell them, look, we'll sit you down and we'll give you a reward. But God, man, just fighting them to use it, just the compliance piece has been a struggle for me.
yeah. I mean, obviously, kids. We find that kids also they can be resistant. So have them wearing the Mile Munchie during the daytime again as a coaching, kind of building up to the nighttime, or the lip tape, same thing. You kind of build up to it.
Okay.
But it's so mandatory. The best thing parents can do is to see whether their child is mouth breathing at night. I oftentimes have parents videotape the child about an hour to 90 minutes after sleep onset, and video their kids about a minute worth or maybe a minute and a half, and send it to me so I can see what's going on during sleep. Is that child have a very extended cervical posture? Are they restless? Is it loud breathing? Is it snoring? Are they obstructing? You can see so much in a brief little video of the child sleeping to know maybe what's going on.
Now, what would you say? I mean, and I know in adulthood, it sounds like there's even some remodeling and beautiful things that can happen. But if we were to just put some cutoff date for kids where it becomes much harder, you'd say that's around 13. You said around puberty. Is that what I heard?
Well, you have growth. So growth technically is defined as displacement plus remodeling. It's a technical thing. So growth is finished for girls shortly after puberty, and boys have a slower growth trajectory up until around 1920. So anytime you have growth, in addition to remodeling, you get a better result. So roughly late teenage years, you're not dealing with growth, but you can still cause remodeling of the jaws.
Okay. Okay. So if we're trying to work, and people listening to, a lot of families listen to this, a lot of moms with kids listen to this. So you would say the action ages, like, well, hey, we need to take action, get this thing as wide, as big, as perfect as we can. Those ages would be what then?
This is another new area. I'm now, I think the earlier the better. The more growth you have left in the system, the more you can alter the trajectory and get back onto course. So I would say the earlier the better. 4 or 5 is definitely a good age. I'm even screening children at 3. I think you should have a screening for airway, and by a dentist, if not a physician pediatrician, by 3-ish, to see what's going on, and to know to inquire about sleep, because we have such a disaster going on in our culture with regard to sleep. Adults don't sleep well. They don't sleep as much as they should. We just have an epidemic of sleep problems on top of, because of our lifestyle and all the other issues and the craniofacial structures.
Yeah.
It's remarkable. We're sleeping less than we did 100 years ago, for sure.
Yeah, I mean, I was in the airport yesterday and everybody just looks exhausted. I was trying to look around. My wife and I would just look around for people like, okay, see who's good looking today. Nobody looked good. I was in the Austin, Texas airport. Everybody looks wore out. Everybody looks exhausted. I'm like,
Right.
damn, these smartphones are keeping everybody awake. And then it's the dental stuff. And I even see the lack of mid-face development. Now that I've kind of delved into this, you'll see it on people. It's kind of crazy. I'm like looking for that attractive jaw structure, and it's kind of rare to see that in the modern culture.
Well, here's a little secret that's hardly ever talked about. I put a couple of posts on my feed, but the facial skeleton is so vulnerable and is subject to constant remodeling, either positive or negative, throughout life. We think of bone as static. No, it's constantly changing over, and the bone that you have now is completely different than the bone that you had 3 years ago, approximately.
Wow.
But if you don't have that tongue up in the palate with lip seal and nasal breathing, your facial architecture will regressively remodel. So we think of older people who have forward head posture, no chin, long faces, open mouth breathing, and we think that's just a sort of what aging is supposed to look like. That's not true at all. Those people have had a lifetime of poor tongue posture, maybe poor swallowing. They've had regressive remodeling leading to a narrowing of the airways, and they're relegated to mouth breathing both day and night. So if they maybe didn't have sleep apnea when they were 20, but they had poor tongue posture and maybe intermittent mouth breathing, by the time they're 50, their faces look a lot worse and their airway is a lot smaller. Now they have sleep apnea.
Oh my God. So that's why a 20-year-old looks so much better than a 50-year-old, because maybe they haven't got into all these bad habits yet.
That's, I think, in part very much, I think that's true. Because if you don't, this bone is not genetically determined. That's a very important consideration. There's no genetic blueprint within the bone like there is in a long bone that's somewhat, genetically programmed for growth. The facial architecture, the facial skeletal system is totally dependent upon function, the soft tissue capsule and the stimulation it provides. If you just look up aglossia on the internet, aglossia is a tragic congenital condition where there's no tongue, and you look at pictures of the jaw structure, it's totally collapsed. The faces are completely destroyed because there was no tongue. So that very much is like prima facie evidence that there's not a genetic blueprint for jaw growth.
I've got a picture of a girl right here.
It destroys the face in a situation where there is no tongue. And so that says it right there. Without soft tissue stimulation, the facial architecture is going to be severely compromised.
And I see a lot of kids that look like this, though, and they probably do have tongues, but I see kids with tongues that look like this.
Yeah, that's right. If that tongue is laying low in the mouth and they're mouth breathing, the entire architecture of the face changes negatively very quickly, unfortunately. Now, a lot of that relates, I think, to breastfeeding. If you want to get into breastfeeding, is a very powerful stimulation of getting the tongue up to the palate and then getting palatal growth and probably augmenting the strength of the tongue to stay up in the palate, right? So our pre-industrial populations breastfed, I think, for about 3.5 or 6 years on average. We're down to less than a year, right, in our culture, when breastfeeding was going on well after solids were being introduced. And that breastfeeding was a major positive myofunctional stimulation for that tongue to get up in the palate and for the palate to expand, And bottle feeding is a disaster for the tongue and the palate.
Yeah. What can you do for the kids that are 2? Maybe they're done with breastfeeding by that point, or if they're off the bottle, they're just doing solid foods now. I mean, do you need myofunctional intervention like myofunctional therapy? Can a kid that young even comprehend tongue placement exercises and such? Do you throw them into like a myofunctional device? What do you recommend for maybe the 2 to 6-year-old group?
You can do a myofunctional device, very low cost and low invasiveness. So like the MyoBrace is designed for primary dentition. There are other growth appliances where you were using in children at 4, 5, even 3, if you can do that. It's harder at that age. But at least get them nasally breathing. Make sure they're not breathing with the mouth open. That would be a starting point. Lip taping can be done a younger age because the lip taping itself is a stimulation for that tongue to start to get back up in the palate. So it kind of follows. Lip seal kind of generates a better environment for the tongue to get up in the palate. And certainly if the palate's already underdeveloped, you can do early growth-directed strategies to try to recover the lost growth. But you'll notice the only way the lips really can stay sealed at night is if that tongue is sealed up in the palate, because it creates a negative suction that kind of holds the lips together anyways.
Yeah, I feel that when that tongue's up there, I do feel that suction you're describing. So, is it just I don't want to say the guide of the lip tape. I've seen some people just going like a vertical tape, but I think people are going to suck through that if they're so bad. So would you recommend trying a full seal if they're really bad?
Well, yeah, it's kind of like an early junior varsity way to do it. Put the lip tape on vertical because it's a little less constricting, and patients feel they have a little freedom so they can cheat. But yeah, doing it horizontal is a more advanced technique that's going to create a better lip seal. And there are other types, myotape and other types of lip tape that can be used.
Okay.
But the vertical is a good starting point, but it's a beginner's level for that.
Okay. Oh, I see. I see the myotape. Yeah, I think that micropore is just so good. It's so cheap and easy, and it seems to work
It
great.
is. We give it out like candy.
That's
We have it
hilarious.
everywhere. We give it out to patients all the time.
That's great, man. That's great. And so, well, maybe I need to get you to order that for me. I don't have an account with MyoBrace. I might want to try that. So you could hook me up and we could
Yeah.
get some for my kids.
Yeah, MyoBrace, there's a J series and K series, and it's a pretty self-directed program. We do supervise with myofunctional instructions and coaching, but
Okay.
the basic principle is when you wear it, you get the tongue partially elevated in the palate, which can help. You stop mouth breathing, and you get the lower jaw forward at night, which stimulates the jaw growth forward. That's another big part of breastfeeding is when you breastfeed, the jaw intentionally goes forward, open up a space between the condyle and the cranium, and that stimulates growth. We know that well. So
Yeah.
there's a whole bunch of things that you want to look at.
Amazing.
But the centerpiece is getting that upper mid face to develop well. There's another interesting nutritional part to this that's been talked about for a number of other people, and that's vitamin K2 and its role in cartilage and septum, nasal septum. K2 works with D and A and maintains the flexibility of the nasal septum, which is roughly 1/3 of the septum. And there's good animal studies that show when K2 deficient states are there, you'll have a restriction of the midfacial growth. And Weston Price, among others, have commented how K2 is not very likely present in our modern diets because of having the lack of access to very rich grass-fed dairy and or meat products. So we oftentimes recommend K2 supplementation.
Okay. Yeah, I mean, I feed my kids butter by the stick, so hopefully they're good.
Yeah, if it's grass-fed butter, you got K2 unless you eat Japanese natto or something. But yeah, K2 would be present more likely then. But you can look up Binder's syndrome. Very interesting, tragic. But again, it's a congenital defect related to warfarin being used, Coumadin warfarin in pregnant mothers.
Oh man, this is not good.
They intentionally lost K2, and you can see the entire midface is damaged severely by the lack of the K2. That was like an unintentional experiment. So that tells me that K2 is a very important factor in midface growth. I would, and that's why you've got to get into grass-fed butter and or milk and or cheese, and then grass-fed beef. And it's even Weston Price acknowledged that the rich green springtime grass, like in the Swiss villages, they would preserve that cream for a wedding gift because of fertility, and it was such a rich food source for K. He called it factor X. It was later decided that was K2. So from books that I've read, that K2 is just not present in our diets, and there's no standard for it. We've ignored it for most of a century, actually, in favor of just knowing a lot more about K1, which relates to clotting.
Amazing. Yeah, did that picture pop up of that girl of the Binder syndrome?
Yes,
Okay.
I saw that.
Good. So that makes sure when we put it on our YouTube, people will be able to see that. That's scary. So that's just a K deficiency.
That's a K2 deficiency, right? Matrix GLA protein is responsible for cartilage flexibility. And you have to have K2 with sufficient D and A in order for that cartilage to respond and grow. Well, there's the experiment. Binder's syndrome. That's exactly tells you that K2 deficiency by warfarin Coumadin in pregnant moms damaged the K2 link there and caused midface deficiency.
Wow, incredible. Anything else you want to tell us? I know you got just a few more minutes left. Anything else we should hit on? This has been awesome. This is exactly what I wanted people to hear today.
Well, I just think we have to, the main thing is that sleep is, in children is so vital, and children are so sensitive to damaged sleep. Intermittent hypoxia is a very serious condition for children, very sensitive developing brains. Children need optimal sleep in order to develop cognitively, physically, metabolically, growth-wise, and we have to be very concerned about what's going on with the quality of sleep in our children. And I think it all starts with nasal patency and whether or not there's mouth breathing. And every parent should be all over the idea of don't let your child mouth breathe, even if you have to tell them during the daytime, keep your lips together, breathe through your nose. The Native American cultures knew this. As soon as they finished breastfeeding, the mother would pinch the lips together to maintain lip seal. They knew that mouth breathing, because they saw the European settlers and how unhealthy they were. And the thing that they noted about these white European settlers is they were mouth breathers back in the 18th century, and they were unhealthy. And the Indians knew that mouth breathing was a very serious problem to health, before any modern medicine, right?
Yeah.
Well, and you don't know if your child's mouth breathing during sleep, so you have to kind of be thinking that could be happening. How do I not let that happen? Well, you've got to work on nasal patency and work on some strategy to not let your child mouth breathe during sleep. Even again, for an hour or two in deep sleep, you don't want it happening.
Amazing. Give people your website. Also, you have an Instagram page where you post some good images. So keep up the good work there. Keep posting that stuff. It's important for people to see it. And you're going to learn. Some things go viral and some things don't. I mean, I've done some videos
Right?
that get, 500,000 views or 1,000,000 views. And I'm like, okay. And then you'll do another one that you think's an amazing video and it'll get 10,000 views. So you just got to keep going and keep doing good work on the social media front.
That's so true. Yeah. My website, Balanced Epigenetic Orthodontics is my practice name, and the Instagram is Dr. David Buck, Dr. Buck.
Okay, cool. All right, yeah, I'm gonna pull it up right here, and then you're located in, is it Linwood, Washington?
Yeah, about 15, 20 minutes north of downtown Seattle, just north, just the suburb of Seattle on the north side.
Cool. Okay, I've got your Instagram page here. Let's just show people this too, in case they're watching on the video. You can see this. Yeah, I like some of these things that you're doing, these educational pieces here, this kind of stuff. So keep going with this. And I think, and look, that's actually the one I commented on. So that's funny. That's how I found it. So yeah, so keep doing this stuff because what I think we need people like you doing is educating the parents on how this is affecting their daily life, not just about the dental structure and all that, but how are they behaving? And do they have these anxiety, depression issues? Do they have chronic fatigue? Are they not performing well in sports? Are they getting more tired easily than other kids? Their performance is lacking out on the field, or are they lacking with their reading, their comprehension? I mean, this is like every aspect of daily parenthood that you'll see these struggles. So that's my encouragement for you would be just keep sharing those stories, because I think for a parent, if you just look at the structure, you're like, oh, I just want her to look pretty and her teeth be straight. But then if you go the extra level and you're like, yeah, but they're going to be less fussy, more focused, better learner. I mean, that's killer stuff right there.
You're right. No, and it's something I'm passionate about. And I have 6 children all grown up now, and I didn't realize some of this stuff until like child number 3 and started working with them. But I tell you, it's like I have sleep apnea. I've treated myself and had been treated for it, but it's amazing how prevalent it is, and it's underdiagnosed like crazy in adults and children. And children, we do screening studies, which you can do with very good equipment that's very non-invasive in a 4 or 5-year-old, but getting into a laboratory and doing overnight sleep studies takes forever, and there's so few of them. And so sleep issues are not in the forefront of the thinking of most pediatricians and most practitioners when it needs to be. As you say, there's so many. I mean, sleep is obviously acknowledged by the leading figures in research and in longevity medicine and anti-aging medicine. Sleep is like in the top 2 or 3. You've got to optimize sleep if you're going to stay healthy and prevent diseases, and that's we need it. And kids need perfect sleep for their cognitive development. And you're right. ADD, behavioral problems, all these issues, most of them are, I think, many of them are related to sleep problems.
Yeah. And so last thing, are you taping your mouth still at night, or you're saying you've treated yourself for apnea? Are you doing CPAP? What are you doing?
So I use an oral appliance for sleep after ortho, which is the ortho fixed part of it. I use a little appliance at night, and I've just gone through myofunctional coaching and training to have that tongue to palate seal. I've worked on nasal lavage, neti pot,
Mm-hmm.
and nasal rinses to make sure I get good nasal clearing. But I was a poor nasal breather with allergies as a kid. I take a lot of supplements and have a very, very clean diet as well. So I had allergies growing up, and I had mouth breathing and poor nasal breathing and all that stuff. It affected me. I got diagnosed maybe 20 years ago and started with oral appliance therapy, then ortho, and then I just use a stabilization appliance. But yeah, I mean, it's affected me personally, and
Erectile
I'm
dysfunction
passionate
too.
about
Erectile dysfunction. Men don't even make, I mean, we could do a
it.
whole hour on that.
Absolutely. You're right about that. The sleep affects that right there. So
Let's do a part two then,
um,
because I know you got to run. It's 12 on the dot here, so let's wrap it up. But we could do a part two
okay,
if you're game, and we could
I'd like to.
let's hit like sexual dysfunction, libido, erectile dysfunction in men, poor, like the nitric oxide issue. Let's get into that.
Yes. Okay.
All right, next time. So we'll wrap it up here. Thank you all for tuning in. Check out the website here. Look him up on Instagram, Dr. David Buck DDS. Check him out. You'll find him. And if you need help, you're local, or even if you want to travel, if you want to get over to Seattle, you want to skedaddle to Seattle, well, then there he is.